Medication. This is what we will be covering today. Staff responsibilities, the effects of medication, special procedures, steps in the medication procedures, medication knowledge, and special issues such as refusal, difficulty swallowing, and behavior changes. Assisting with medication administration is a serious responsibility. Medication is a substance or mixture other than food that is used to prevent disease, aid in diagnosis, treat a disease or reduce symptoms, maintain or restore normal function. Medication treatment program needs many people to make it work. A nurse, physician, the staff, the pharmacist, DSP, the behavior analysis, and the individual. People in the medication administration process. Physician prescribes medication. The pharmacist fills prescription and dispenses medication. A pharmacist is the only one who can dispense the medication. The nurse monitors the person, and the DSP assists in administration, observes, and reports. Medication administration process. Medication administration is more than simply handing out medication. It is a cycle that includes the four areas: observation, prescription, administration, and documentation. Each of these areas are important and lead to another area. Observing a change in a person leads to documentation. Documentation influences the physician's prescription. The prescription determines the administration. The administration requires documentation and observation of the changes that should occur in the individual. So each of these areas has a cause and effect relationship with others. So throughout the medication cycle, the person's behavior, the appearance, and symptoms before medication is prescribed and after medication is administered. Staff responsibilities: observing, note changes, informing the physician of changes, take prescription to the pharmacy, administration the medication is ordered and then document, know the potential side effects of the medication. Here's an example of how a DSP observes and reports. David lives in a group home. He has seizures 3 to 4 times a month. He currently takes Dilantin. Staff noticed David was unsteady when he came to breakfast and reported it to the nurse. The nurse recognized this unsteadiness as a possible side effect of Dilantin. Although David was not due to see the physician for another month, the nurse called to inform the physician of the observation. The physician requested a laboratory test to see if David's blood level of Dilantin was too high. The test revealed that it was high, so the physician prescribed a lower dose of Dilantin. The pharmacist sent out a new prescription, and David's unsteadiness decreased and gradually disappeared. The role of the DSP is to observe and report. DSP should not make judgment about medication. 4 general responsibilities of staff. Number 1, know and adhere to the laws and agency policy. 2, apply normalization and teach independence. 3, Know and observe the effects. 4. Ensure safety and sanitation procedures. I'm going to elaborate a little bit more on the responsibilities of the staff. 1. Know and adhere to the laws and agency policy. So we need to follow the policy on how to pass medication. If there's any med errors, then we go to the agency policy to find out what we need to do. Know your boundaries. Perform only skills trained in at this agency. Staff are considered certified to pass medication when have passed the medication module test and all the required practicum, the observation and the written practicum. Follow agency policies. Work under the agency nurse's license. No storage requirement. Verbal orders. In North Dakota, only a licensed medical person, the agency nurse, can take verbal orders over the phone. If the physician calls, the staff transfer the call to the agency nurse. The verbal order is written down by the nurse and signed by the physician as quickly as possible. Controlled substance. Controlled medications are those which are likely to be addictive. Examples of addictive medications are Ambien, Demerol, Valium, Xanax, hydrocodone, all of those that help people with certain behaviors. What does this mean to staff? Staff are responsible to know if the medication is a controlled substance, what is it for, what are the side effects, what are the interactions, and how is it supposed to be stored. How does this act affect you in your work? Controlled medications will have a warning statement on the label. Caution. Federal law prohibits the transfer of this drug to any person other than the patient for whom it was prescribed. It will have a warning label with a bunch of stickers on there saying drowsy, could cause person to be dizzy. Do not drink and drive while taking this. Controlled medications have limited refills, 30-day supply. Controlled medication required a separate double lock storage. Controlled substance may need to be counted each shift or after each time it is administered, and it requires 2 signatures. Applying normalization and teach independence. Applying normalization and teaching tools. Despite these laws and policy, every effort should be made to use the procedure as normal as possible within the rules and regulations. This means avoiding practices that draws unnecessary attention to the fact that individuals are on medication and that decrease the concept of normalization. Examples of, and this would be an example of least restrictive. What we don't want to do is have people line up to receive medication. Shout out the names of the people to come for medication. Have people wear identification tags or bracelets. We do not want to do that. That's not normal. Let people do much for themselves as possible. Individuals may vary in their ability to be involved in the medication process. The interdisciplinary team decides what should be taught. Active support is helping people to be actively, consistently, and meaningfully engaged in their own life regardless of their support needs. Ways that you can use active support to engage individuals in the medication process. You can have them use the phone to make appointments, arrange transportation to the appointment, pick up prescriptions, bring a glass of water to the medication room, know the effects of medication, knowing when to take the medication, and individuals may vary in their ability to be involved in the medication process. There are more active support ideas for medication. They could unlock the box or unlock the drawer. They could do hand-over-hand assistance. A person could touch the bottle of the medication to indicate which one they would like to take next. Post-it notes. They could wash off the table or set up Alexa, a Google reminder, to remind them to take their medication. Or maybe a list of meds, have them explain to you why they take this and why. What is it used for? And when do they take it? 3, know and observe the effects. We need to know how the person looks and acts most of the time. What medication they are on, desired effects and response time, what the potential side effects are there when taking certain medications. When working with individuals, your job is to observe and report, and so it may help to use all your senses for clues to side effects. Visual, what you observe on the outside. Auditory, just listen. Maybe it's the breathing. Is it shallow or heavy? The smell, is there any body odor? Touch, are they warm, cold? There are 3 broad effects of medication. One is desire effects. When the prescribed medication is working correctly, the medication is producing the desire effects. The desire effect is what we want the medication to accomplish. So when I have a headache, I take Tylenol, my headache went away. That's what we want to accomplish. I have seizures, I take Dilatin. I haven't had a seizure for 6 months. Side effects are effects produced by medication other than the one for which it was prescribed. Side effects may be expected and predictable, or completely unexpected and unpredictable. Side effects can be relatively harmless or potentially fatal, such as severe allergic reaction, which is further discussed below in the next few slides. Side effects may show up as a physical or behavior change. So when I take Dilatin, it's normal for a person to be drowsy from that medication. That is normal. If the doctor prescribed an antibiotic or penicillin for an infection, all of a sudden I break out into hives, my tongue got swollen, or I got a rash. That is unpredictable. So you want to be on the look for anything when they start something new. If there's any rash, blurred vision, diarrhea, vomiting, fainting, swelling of the tongue, itchy, anything. It's really important, and it's your responsibility to observe and report all the effects to the nurse and supervisor. And no apparent effects is sometimes there's no apparent effects from taking the medication. So I have a temperature of 103. We went into the doctor gives me this medication and says, take this every 4 hours until your fever breaks. I took it when I got home, 4 hours later, I took my temperature, it's still high. I repeated this every 4 hours. After 24 hours, the temperature is still high. So the nurse called the physician to let him know of my situation to find out what we need to do next. Okay, the DSP, the most important thing of the job is to observe and report. And so you want to be observing for allergic reaction, especially if they're taking new med or taking anything that's over the counter. Reaction can occur anytime, but most often after the first few doses. Things you may see are skin rash, diarrhea, itching, watery discharge from nose, irritability, tiredness, hives. Staff are responsible to know the possible interactions of the medication with other medications. A severe allergic reaction is an anaphylactic shock. It is a medical emergency. Medication interactions. Potentiation is an increase in the effect of one or more of the medication. For example, one would be if you were drinking alcohol and a muscle relaxant, they both are relaxers. So they intensify each other. The same with if you're taking Coumadin, which is a blood thinner, and you took an aspirin, that's also a blood thinner. It's going to intensify one another. Antagonism is a decreasing effect of one or more of the medication. So when you take tetracycline with milk, it blocks that medication from doing its job. And then unique effects is some combination of medication produces new and unique effects. So it's really important that we know what our individuals are taking and to make sure that when we take them into the clinic or the hospital, that the medication list at the clinic matches our MARs. So that the doctor is able to prescribe a medication that is compatible with the current list of medications. Following your agency policy. Follow your agency policy when no apparent effects after response time. Staff responsibility if suspected medication interaction is to report it to the nurse or supervisor. It's really important to document the symptoms that you observe. And negligence is a failure to give any care, omission, and or giving poor care, commission. So it's really important to prompt them to take the medication and to make sure that they're taking it consistently, and to, when you're going out and about in the hot weather, making sure they drink lots of fluid, wear sunscreen, bug spray, and in cold weather, make sure that they're dressed warm. Medication response can be influenced by illness or disease, body weight, age, and gender. Characteristics to know about people we support. One is general appearance. How is she or he dressed? Are they well groomed? Is there any body odor? 2, body posture. Is the usual posture good or slumped? 3, general state of health. Are they strong or frail? Are there symptoms of illness? 4, physical activity level. Is the usual pace fast or slow? Do they need assistance? Is there tremor or paralysis? 5, physical condition of the skin. No color and texture, rash, bruises. 6. Physical condition of the hair and scalp, texture, quantity. 7. Physical condition of the senses. Is their hearing aid working? Do their glasses break? Are they able to see? Numbness. 8. Speech. Are they verbal or nonverbal? Are they slow or fast? Are they slurring? Number 9. Mouth, gum, and teeth. What color are the gums? Do they have teeth or dentures? Are their dentures fitting? Do you hear that clicking sound? Are the teeth broken? How about the breath? Is there any odor? 10. A facial expression. Are they happy, sad, flat, anxious, or strained? 11. Vital signs. What is their usual temperature, blood pressure, pulse, respiration? Are those off? 13. Weight. What's their usual weight? Is it a normal weight for their height and body build? Are they losing weight too fast? Are they gaining weight? 13. Bowel and bladder. Are they having regular bowel movements? What is the appearance of the urine or stool? 14. Appetite and eating habits. Are they fussy eaters? Are they hearty eaters? Do they eat at all meals? 15. General emotional state. Are they happy, passive, uncooperative, depressed? So if they're usually outgoing, but they now lately you notice they don't want to leave the room, that's something we should be concerned about. 16. State of awareness. Alert, inattentive, drowsy. Do they know what's going on? Where are they? Number 4. Ensure safety and sanitation procedures. When do you wash your hands? Washing your hands is the most important thing you can do in this area of work. How long should you wash your hands for? 20 seconds. When should you wash your hands? Wash your hands before and after administering any medication. After assisting with toileting, immediately after contact with blood or vomit, before and after preparing meals and snacks. Safety. Never recap a needle. Use gloves when taking blood sugar. Protective barriers are gloves, protective face and eyewear, gown, apron, and protective clothing, hand washing, avoiding accidental cuts and needle sticks, cleansing and disinfecting. The 6 rights of medication administration. Right person, right dose, right time, right route, right medication, and right documentation. If you follow all of these during the medication process, you should never have a medication error. If you cannot remember the 6 R's, here's what you can do. Just remember what's on the bottle, the right dose, 25 milligrams, the right route. The medication can come in various routes. It can come in a pill form, eardrop, eye drop, lotion, suppository, under the tongue, a shot. It can come in various routes in your body. Time, right time, 2 times a day. Right individual, it's going to have the individual's name on there. Right medication, going to have a list of medications on the bottle. And then right documentation is what you note in the MAR. If you can't remember it, then think of the Tim, Dr. Tim. D stands for right dose. R stands for right route. T stands for right time. I stands for right individual. M stands for right medication. And D stands for right documentation. It's really important to know the 6 R's. You'll need to know those just for when you work with individuals to make sure you got the right dose, the right route, the right time, the right individual, the right medication, and right documentation. Right person, you want to identify the person before giving the medication. You want to know the person and only give medication to one person at a time. There should only be one person in the medication with you in the medication room. Right medication. You want to make sure to match the label and the MAI. They both have to match. If there's a discrepancy, we need to get that resolved. You can do that. If you have questions, contact the nurse or the on-call or the pharmacist. We always want to check the label and the MAR 3 times during the medication process. Follow the agency policy to report discrepancies or differences. Medication should always have a label on the bottle or the blister packet. If there's no label, or the label is ripped, or the label is stained, we need to get a new label. Here is the blister pack that we are currently using for the people we support at Red River. As you can see in the left-hand corner, it lists the 6 R's. Each individual is individualized, so you need to get to know them and what they are able to do independently. So each individual is individualized. You may need to assist them with pointing to where to pop the blister or hand over hand. So just get to know the individual and help assist them in taking the medication. What these medications are for: anticonvulsants control seizures, antibiotics treat infections, antidepressants relieve depression, insulin treats diabetes, steroids reduce inflammation, antacids relieve upset stomach, laxative relieves constipation. Right dose. Right dose is making sure that they have the right milligrams of medication that they're required to take by the doctor. So if they're supposed to take 325 milligrams of Tylenol, you want to make sure they are taking the 325 milligrams, not the 500 milligrams. Therapeutic range is a range of doses that can produce desired effects with minimal side effects. Right dose. Make sure to read and count the number of tablets and capsules and make sure it is the right strength the individual should be taking. Right time. Taking the medication at the same time every day keeps consistent levels. we have a 2-hour window with taking medication. If they take it at 5 o'clock, they can take it 1 hour before to 1 hour after. This is according to our agency policy. Contact nurse if outside of med time. Right time. Medication taken on an empty stomach enters system quicker. Medication required to be taken before eating means the medication should be taken on an empty stomach. Medication taken on a full stomach avoids irritation. Right route. The part of the body to which the medication is administered. Internal is taken by mouth and swallowed. External is applied to the outside of the body. For example, cream, lotion, eye drop, ear drop, and internal and external medications are stored separately. Abbreviation. PO is by mouth. Opt is pertaining to the eye. Think of ophthalmologist. Otic is pertaining to the ear. IV is intravenous injection. FL is sublingual, under the tongue. Right documentation. Documentation is done immediately after medication is given. Only the person who gives the medication can initial the MAR. Here's the medication administration record, or some people call it MAR. It's kind of hard to see, but you will be looking at these when you do your medication observation. Away. When the individuals go away for the weekend, family and friends need instruction on giving medication if the individual supported will be with them during medication time. Procedure for medication administration. Medication administration. When passing medication to the individuals we support, you want to make sure it's the correct time to give the medication. Wash your hands before handling medication, and when you move on to the next individual, you need to wash your hands again. Unlock the medication storage cabinet. Check the MAR and label 3 times. Teach throughout the process. Liquid medication administration. Number 1, shake before pouring. 2, pour away from the label side. If the label gets stained, we need to get a new label. 3, pour at eye level. So bend down and make sure you got the right level of the medication. 4, pour just before giving. 5, do not mix medication. 6, observe swallowing. 7, we do not use kitchen tablespoon for measurement. We use the designated container to administer the medication. Medication administration procedures. Number 1, remove the right dose. 2, observe the person swallowing it. Replace the medication in the locked storage. Chart the medication and observe for desired side effects. Medication administration record, short for MAR. Medication can only be given when ordered by a physician. Standing orders are used for medication for headaches or colds or something that the person doesn't need every day. That could be an over-the-counter medication prescribed for a specific reason. Procedures for PRN medication standing orders. PRN means only as needed. It is a term applied to prescription or over-the-counter medications that are taken only if the individual has symptoms which can be relieved by the medication. For example, if the individual came up to you and said they had a headache, you gave them some Tylenol, and it was 3:30 p.m., you gave them the Tylenol, you'll need to check on them a half hour later. So at 4:15, which is a half hour later, you check on the individual. There is no further complaint about the headache. So you will need to note this in the MAR that you gave them the medication, what was the reason, headache, and then note that no further complaints about the headache. This is the standing order form that we get from the doctor, and this is a list of all the products that we can get at the grocery store, Walmart, CVS, and this has to be okay by the doctor for the individual to take, because some of these might counteract with the medications they're taking. So it has to be okayed by the doctor. This is the first page, and here is the second page of the standing order form. I'm sorry it's hard to see. You will be shown this when you do your medication observation. You can take an aspirin or other over-the-counter meds in your home without checking with your doctor or keeping a written record of when you took it. People receiving services from our agency do need a doctor's order to take aspirin or other over-the-counter medication. Follow your agency policy on orders for any non-prescription medication. Medication Administration Record, MAR. Medication given are recorded on the MAR document. Your job is to make sure you're giving the medication at the right time and to make sure you got the right dose, and after observing them swallowing it, you can initial it. If you do not understand the label as written, please contact your agency nurse or on-call. Medication Administration Record. On the MAR, use ink, black or blue ink only. Write legibly. Do not use whiteout. Don't erase or scribble out or use felt tip pen. Do not document for someone else, and MARs are legal documents. If the person has difficulty swallowing, make sure they are in a sitting position. They can take small sips of water before medication. Take one tablet at a time. Take sips of water after each tablet. And take medication with food like applesauce, yogurt, jelly. If the person refuses the medication, try again later. Wait 5 or 10 minutes. Do not give them attention. Offer choices. Hey, do you want to take your medication now or start your laundry? Ask the preferred staff. Use the sandwich technique. Compliment, action, and then benefit. Or you could use the PREMAX principle. You do your favorite activity after taking the medication. Or accept the refusal. If they're right, our responsibility is to follow the doctor's orders. Continuing to review. People have the right to know why a medication is prescribed, the benefits, and the potential side effects and any changes in the medication order. So you might want to say, hey, why do you take this medication? Oh, it helps your blood sugar. Great. Oh, and if you don't take it, this is what's going to happen. So it's a teaching method to help you and the individual to learn about the medication, why they need to take it. If they still continue to refuse, notify the nurse or supervisor, check the refusal, and option to consider, why are they refusing? Is it the time of the day? Could it be the medication they are taking? They don't like the taste? Maybe they're having difficulty swallowing it. Maybe they'd rather have a liquid or chewable. Or think about maybe it's a new staff. Maybe they got to get to know the staff better. Because sometimes new staff might make them feel uncomfortable. Or maybe you got to think about what's going on. If somebody scheduled my medication passing during Wheel of Fortune, I might be disappointed. So, and then allow them time to think about it. Sometimes they'll come back after 5 minutes. I do need to take that. Yeah. But if they still continue to refuse, then we need to call a team meeting to discuss what to do. Medication is a violation of any one of these rights. If you give the medication to a wrong person, you gave the wrong medication to that individual, you gave the medication at the wrong time, you gave them the wrong dose. It should have been 200 milligrams, not 500 milligrams. You gave the medication in the wrong route. You gave it to them in the eye instead of the ear. And wrong documentation, not recording it properly. Medication errors. All medication errors must be reported immediately. You must follow the agency policy. Call the supervisor and the agency nurse and fill out a GER, General Event Report on SARA. Medication and behavior. When there is a challenging behavior, what we want to do is assess the environment to find out what is causing that. Is it flickering lights? Is it cold? Is it smell? Do they have new coworkers, a new boss? Are they in a different room? Do they get a different job? What is the behavior telling us? Do they not like it anymore? What adaptive behavior could we teach that person to the same function? And then we want to look at changing the environment before considering the medication. Medication and behavior. Medication is not the first choice or a permanent solution. Teaching adaptive behavior along with medication can be considered a complete solution. Medication certification. You are now ready to take the test. For Fargo staff, please schedule open testing time to take tests on Sign Up on Bamboo. Or if you are in Wahpeton, you can go to the DSS between the hours of 8 a.m. to 4 p.m. to take the test. You will need to get an 85% or higher. If you pass, you will be given a medication written and observation practicum to complete. Once you are properly trained, a nurse will test you. If you pass, he will certify you to pass medication by notifying the training department that you passed your medication observation test. We will update this in our training profile. and every year you will need to get med certified annually. Thank you.